Every year it's different. Every year you notice a change. And it just crept up on me. Old age crept up on me. But I don't like to think of myself as old.
It was Thanksgiving 2011, and she was just walking into the bedroom and fell. And so I had to call an ambulance, and the paramedic said she's got a broken hip. We could feel the hip like broken. And that was the start of it.
You get to depend on people for different things that you never would before. You have to give in to it and not be too proud to ask. That's the thing.
It was just my job, and I took care of her, and really I didn't find it difficult. But when she got ill, of course that was difficult. And they recommended to me that she not come home, that she come to a place like Deltaview.
Well, I was sitting watching television, and I didn't get my knees totally uncrossed, and I got up one foot sort of up in the air, and I tumbled forward. But I was able to get up by myself. I've got enough strength that I don't have to worry about getting up.
Everybody falls sometimes. It's a very big thing with older people, falling. It's one of the worst things that can happen.
Well, I think fall prevention is very important because as an elderly with a fractured hip, it can take away a lot of their mobility. And if they don't rehab back to walking, their quality of life, I believe, diminishes quite a bit from when they were walking.
If I hurt myself, it might be different, but because I do a lot of walking, my bones are, especially these bones in my lower half of my body are very strong, and I keep them strong by walking. But I don't want to be in a walker. I want to walk on my own. Because you get dependent on something.
I think the main reason that people do fall when they're high fall risk is because we give our residents a lot of freedom to move around. So we can't possibly watch everybody in all corners of the facility at all times.
Well, it's reasonable if you're used to getting out.
I think maybe after working like a full week, your patience wears down slowly. And I think that's the biggest challenge, is keeping calm and always being very patient with your residents, no matter how stressed out you may be.
And it's hard. It's harder on an older person. You might start getting grumpy.
What led me to work in a long-term care facility is my passion on working with elderly residents. I believe that they're here to spend the rest of their lives. So I find it very uplifting to help them have that quality of life during the last few years of their life. We believe in the concept called hugs, not drugs. Look at the whole person and see what they can do during the day instead of giving this medication to calm them down or to settle them down.
I think to a certain degree, there's only so much you can help somebody or influence them. And when you can't help them anymore and you feel kind of helpless, it's like, oh, I really just, there's nothing left I can help this person with or do for them. I think that's the worst feeling.
Well, you really have to go along with what they say.
You got to give somebody the, got to boost them on and tell them they can do it, not tell them they can't do it. You know, they need encouragement.
And just be with them and make them feel comfortable. That's